One of the greatest challenges providers face within their quality improvement efforts is knowing where to get started. The underlying problem is found within the size of a healthcare system. Within a large healthcare system, there are so many processes set in place, it is difficult for providers to determine the best place to start. What they need is a tool to pinpoint their efforts, where they will receive their biggest bang for their buck. In order to pinpoint where providers should start, we will learn how to formulate and assess interventions to achieve clinical quality improvements, how to implement these interventions with the use of a three-step process, and how to evaluate the outcome of clinical quality. Through healthcare reform, new data analytics systems were created to make better, faster, and real-time health care decisions. In order to achieve the new goals of reform, Health Catalyst adopted a new model called the Healthcare Analytic Adoption Model. The purpose of this model is to assess the framework for evaluating the industry's adoption of analytics in order to create a roadmap for organizations to measure their own program's progress through data analytic adoption. This will provide the organizations with the ability to achieve their goals of quality care, clinical and patient satisfaction, meanwhile reducing the costs through data analytics. As you can see, the analytics adoption model has a 0-level to 8-level hierarchy showing the data collection stages, the data sharing stages, and finally data analytic stages. To improve clinical quality, there are 3 steps we should follow. Step 1 is to implement a healthcare enterprise data warehouse foundation. Step 2 is to identify the improvements priorities of the 80-20 rule, and Step 3 is to gain the consensus of the clinical teams. Step 1 is to implement the healthcare foundation through the use of an enterprise data warehouse, or an EDW, which is a systematic way of being able to consistently have data available to analyze one's goals of quality improvements. This system will provide the organization with standardized treatments of data, and one can grow a business's needs to receive various types of data without having to compromise the security and the integrity of the data being collected. This will provide the organization with a foundation. The implementation of the Key Process Analyst tool, or the KPA, identifies the variation of care processes and cost-driving clinical areas due to the use of the 80-20 rule, where 20% of the care processes are being consumed by 80% of our resources. This uses the works of the EDW to aggregate the data through clinical, financial, and operational standpoints to discover which areas of the operation need the greatest opportunities of quality improvement. To gain consensus on clinical quality teams, the organizations are able to review the specific data to redefine the areas of weakness in order to redefine through quality improvement. Through the data collection of the KPA, the organization is able to collaborate with clinical cohorts in order to determine the best ways to reduce these variations while being able to improve care at the same time, thus improving the overall quality of care and be able to maintain the focus of the triple aim goal. According to the CDC, the urinary tract infections are the most common type of healthcare-associated infections, causing 450,000 annual infections that lead to 13,000 deaths, increasing lengths of stay as many as 4 days, and increasing healthcare costs as much as $500 million per year nationally. North Memorial Healthcare is an 518-bed health system that also saw the increase within UTIs within their facility. In order to find a solution, they established an enterprise data warehouse that will allow the enterprise level to maintain the data while they eliminate the use of charge nurses to manually track the data and allow them to focus more on patients versus reporting. The KPA also identifies CHF, chronic heart failure, as a leading cause of the highest cost of care for those being readmitted due to inadequate treatment, discharge guidance, and follow-up, where an estimated 24% of patients were discharged are being readmitted to the hospital within 20 days to 30 days. To find a solution, they implemented a data warehouse with the use of the KPA to focus on aim statement goals to assess interventions and impact on costs and patient satisfaction. Within 8 months of introducing the EDW, we saw a reduction in readmissions by 29% in 30 days, 14% in 90 days of readmissions, and 120% increase in follow-up appointments. A healthcare organization just needs to be able to pinpoint where providers should start, such as formulating and assessing interventions to achieve clinical quality improvements within their particular organization, to implement these interventions through the use of a 3-step process, and to evaluate the outcome of clinical quality. Unity is strength. When there is teamwork and collaboration, wonderful things can be achieved. Clinical improvement and quality improvement is a team effort. It is a deliberative action by the teams within a hospital or a facility. Discovering these outcomes will allow not only the lowering of costs, but the improvement of clinical quality, patient satisfaction, and the improvement of overall clinical patient quality care.